Pop quiz number 146. A client who does not speak or understand English has an interpreter at the bedside assisting a nurse with an admission interview and assessment. Which action is most appropriate for the nurse while utilizing the interpreter? 1. Asking questions directly to the interpreter. 2. Asking questions directly to the patient. 3. Asking the interpreter to step out of the room while completing the physical assessment. Or 4. Allowing the interpreter to rephrase questions in response instead of interpreting each word. And guys, the correct answer is 2, asking the questions directly to the client. So you're going to be looking at that patient directly because you want to see their body language. What tells you more, words or body language? Body language. So you're going to look at the patient directly when you ask the question, even though the interpreter is going to be the one interpreting your question and telling you what the answer is. But you want that patient to know that you are talking to them. You want to maintain that eye contact and communicate with them. Something else that's important to know when it comes to interpreters, you always want to try your best to get an interpreter as close to the socioeconomic class as your patient as possible, because in some cultures, if a patient is from what's perceived to be a lower socioeconomic class, they may not want to divulge certain types of information. So if you get a test question asking you about that, make sure you choose the answer of the interpreter from a closer socioeconomic status of the patient.